Well, from midnight, to anyone aged 18 or older will be eligible to receive a vaccine. That decision was made by Cabinet amidst warnings by the Health Department that a fourth wave is inevitable. To discuss, we're joined by the Acting Deputy Vice-Chancellor, Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela. Professor, thank you for being with us. Do you agree with me that the vaccines are the good news, but the bad news is there's a lot of vaccine hesitancy among young people? So we're not sure exactly how many will take this up.
Greetings, Francis, and to the viewers. In my own opinion, I think that, yes, it is indeed most welcome news that from tomorrow the youth will also be able to get vaccinated. And especially because they constitute 18 million in terms of the adult population group that we are targeting with vaccines. And they will certainly contribute a large proportion to the effort towards increasing the coverage for vaccines. And if we were to just kind of, for example, look at the ones that are most enthusiastic, and assuming that they are roughly around 50% or so, that really contributes about 9 million people into the adult, and that can really help to break transmission infections. But I agree with you that there are concerns that there is the willingness to take vaccines is low. But I do think that because the news spread really fast amongst the youth, as soon as they start to engage with the vaccine and realize that many of the things that are being said are fake news, they're not necessarily true, the positive message will spread really fast amongst them. And they may actually begin to surpass our expectations in terms of taking up the vaccine.
There is a lot of misinformation. On the one hand, do you think the government should have been counteracting that much more effectively with a huge communication drive? Maybe this is also the media's fault, but I think people still have basic questions or concerns around vaccinations. And if you don't deal with those, then they harden, their perceptions harden, and they don't want to go and get the jab.
Yeah. No, absolutely. I think this has been my biggest issue in terms of communication around, COVID-19 generally, but specifically around the vaccines. I think in general, we tend to be slow to respond to issues and concerns. And, in other times, perhaps we can cope with that. But in this case, where there is such a sense of urgency, we don't have the luxury to wait. We need instant communication. We need people to have their questions addressed immediately. And especially when it comes to the youth, people between 18 and 34, they live on instant messaging, instant exchanges, and information needs to be instant for them as well. Because then the longer they sit with questions, it increases a lot of anxiety, and they then have to build their own coping mechanisms. The government needs to make sure that they are able to send a clear message that they care about them, they care about their safety, they care about their well-being, and whatever concerns or questions they have will then be addressed. Sometimes government may not have the answers, but they can at least provide them with details around what is it that is being done to make sure that those answers are being found. I do think that a campaign here becomes important, and it's really a campaign to be able to respond to queries instantly rather than just sending out information. It's about a dialogical type of communication we are talking about.
Well, I guess we have a chance now. Professor, you deal with young people and future leaders. And what would you say to people who are between 18 and 34 years, maybe tonight, thinking maybe sort of sitting on the fence? So what would you tell them?
Yeah, I think for me, what's important to the youth is to say that, yes, there has been a lot of things that have been said about vaccines, a lot of negative things that are inducing a lot of fear and concerns. But there's two things that, should give the youth hope. One is that when we started off, we thought that, the adult population will be slow to take vaccines because of concerns. But the people who are above 60 are now more than 60% vaccinated, and they are very enthusiastic. Even the study showed that they've now become the most enthusiastic, and that has to do with the fact that they've had the lived experience of the vaccine, and the positive messaging comes from their positive experience to a large extent. And yes, there may be things that need to be answered, but government will answer those questions, and we've seen a positive response. Just government opening up early for the youth means that government is listening and is responding, and we need to make sure that even the youth, whatever questions or comments that are inducing fear, that they can raise them and they can be addressed. The last thing I just want to say is that, there is so much that South Africa is intended for in terms of the rest of the year and trying to bring normality to society, and the youth are the ones that are eager to get back to normal, like most of us. But we need to just make sure that we are all being part of the solution. We can be able to go to stadiums and watch games, as we have seen in other parts of the world, where we've got more than 50% coverage of vaccination. And that, for me, would be really positive.
Yeah.
And will answer many of the questions as much as possible on our end.
Professor, thank you. And finally, and very quickly, the vaccine hesitancy, how is that affecting predictions, maybe your predictions around the fourth wave that we're expecting? How soon could that be? What are you thinking right now?
Yeah, no, I mean, it's very hard to tell. It will depend on really how much vaccination uptake we have. In fact, for me, I'm still worried about the long tail of the third wave, that we are not bringing it down. That's what I've been focusing a lot on. I know other people are looking at the fourth wave already, but personally, I've been trying to focus on some of the contributors to the delayed, ending of the third wave, and that's been my main focus. Otherwise, I do think that every day for me is important in terms of ensuring that we can get as many vaccines per day that we can, given the capacity that we have. That's the priority.
All right, we have to end it there, but let's chat again about why we're not coming out as quickly as you expected. Deputy Vice-Chancellor, Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela.